Well, hello there. Thank you so much for coming and joining us on my channel here. I'm Dr. Perkins, a board-certified OBGYN, and today we're talking about, can bacterial vaginosis make you feel sick? We will talk about what exactly is bacterial vaginosis and the symptoms that are associated with this. We will differentiate between the classic symptoms as well as those things that are atypical. And then we will dive into the complications that actually can make you feel sick. So let's talk about it. What exactly is bacterial vaginosis? Well, it is a very, very common infection that happens to a female from an overgrowth of a bacteria called Gardnerella vaginalis that often lives in the vaginal space. But when an infection is caused, this is because there's an overgrowth of this bacteria in your space. And so typically, a lot of people do not actually have symptoms. And because of this, you can go sometimes years without knowing that this infection exists. Now, for those who are symptomatic, the common symptoms are having a thin gray discharge, as well as having a fishy odor that is often stimulated by sexual intercourse. Now, the reason for this is that the bacteria just releases this hormone whenever there is activity around it. So whenever there's any physical activity, it stimulates the release of this odor. Now, sometimes I have had patients say, you know what, I just feel off. Like something just doesn't feel right. And then we get some testing done and there you go, bacterial vaginosis. But what does feeling off mean? It's really hard to objectively state what that is like because it's just so subjective, and it's really hard to share what that truly means. And so let's talk about what we actually know. We do know that sometimes having bacterial vaginosis can cause you to be fatigued. We know that you may have some pelvic discomfort that could be in the form of fullness or even almost like bloating, just a lot of discomfort and fullness down there. We also know that you can have some degree of malaise, which is just feeling out of it, like feeling weakened to some degree. And this is because bacterial vaginosis can impact your systemic body and not just locally with symptoms. And the way that it does this is by causing a more systemic inflammation to occur. Now, in general, when we think of our blood vessels and the blood that passes through them, we know that there are a lot of different components to your blood. We have our red blood cells, which helps with our blood levels. We know that we have our white blood cells, which goes and kills bacteria if it does enter into our system. We know that we have things called cytokines, which cytokines are an inflammatory marker or markers that increase whenever there is inflammation. I think of inflammation as almost like a construction zone. We know that something is broken that needs to be fixed, and we need workers to come in. And when the workers come in, it just becomes so congested. That is almost like inflammation in your system. Your body knows that something is off, and it uses and brings all its workers to come and now control the area and try to bring it back to a normal basis. And so cytokines do that job. And we know that whenever you have bacterial vaginosis, cytokines are increased in your system. So systemically, your body recognizes that there is a problem somewhere and tries to fight it off. This type of reaction or inflammation can now lead to you being fatigued. It can lead to you feeling off because your body is recruiting so much to help to figure out and fix this problem that could be bacterial vaginosis in the vaginal space. Your vagina loves to be acidic. Bacterial vaginosis often occurs when your vagina is not as acidic as it likes to be. Whenever your vaginal pH rises, That is anything greater or outside of the normal range, which is 3.8 to 4.5. The vagina then becomes a space where bad bacteria can overgrow. This is often what happens with bacterial vaginosis. We have an overgrowth, or we have bad pathogens that are overactive because your vaginal pH isn't in the range that it should be. And when this happens, this also opens the possibility of having other infections as well. STDs are much easier to be transmitted to your system when your vaginal pH is higher than where it should be. It also means that your likelihood of getting things like a UTI increases when your vaginal pH increases as well. Now, outside of all these possible infections that are being caused from the vaginal space, there is another type of infection that I want you to be aware of. This infection we call PID. It is pelvic inflammatory disease. This is actually an infection that can be linked with bacterial vaginosis that can cause you to feel sick. It can cause you to feel not so well. The infection that we refer to as PID often is caused by bacteria that lives in the vaginal space, and it ascends. And I'm going to bring my model so you can kind of understand where we're going here. This is the vagina here. We have our microbiome, we have all the bacteria and fungus and everything that lives there typically. When we have a pelvic inflammatory infection, these are infections that are more on this level. And I say on this level because this is the top of the vagina here. Infections that occur above this, so anything above the vagina, we consider to be, if it's in the pelvis, pelvic inflammatory disease. Anything that's down here on the lower side in the vaginal space is just a local infection. Sometimes bacteria can move from the vaginal space, move up through the cervix, through our tissues, into the uterus, into the pelvis. We have other organs on the inside. And now this entire area here becomes infected. That is PID. And so, yes, it can be started from just having a simple bacterial vaginosis infection. It can. It could also be caused by an STD like chlamydia or gonorrhea or trichomoniasis, all of which you can increase the likelihood of getting if you have bacterial vaginosis and your pH of your vagina is higher than it ought to be. So do you see how this can all be linked to each other? And now while BV in and of itself oftentimes can be asymptomatic, there are times that it could be symptomatic, and there are times where it can increase or it can worsen by becoming a greater version or a greater infection that can honestly cause you to be quite ill. BV can be recurrent, BV can be annoying, BV can be frustrating. But in knowing all of this, what I want you to really take away at the end of our conversation today is 1, getting treatment, 2, getting tested, 3, understand when your symptoms are too much and you need to worry. And so when we think of PID, we're thinking about having things like fevers and chills and extreme pelvic pain and severe pain with sexual intercourse. Things like that are reasons why you want to seek attention and go to the doctors right away. Sometimes we may need to consider using other things like boric acid. We know boric acid helps to maintain vaginal pH, decreasing the likelihood of an infection. And so maybe we need to incorporate that in your lifestyle. There's so much that can be done, but it requires having that conversation with your provider. It requires being tested to make sure that your symptoms are not due to something else. It requires being seen. I hope this information has been helpful to you today. There's another video that I think will be very helpful as you course through life and this infection, and I've linked that below in the description today. Click on that link, join me in that video, and we will talk about bacterial vaginosis to a deeper degree and things that you can do to help your scenario. Thank you so much for listening, and thank you so much for being here. Leave a comment below, and I'll see you next time.